I'm Sriram Natarajan. I'm the Executive Director and CEO of Malbio Diagnostics. So Malbio Diagnostics has come up with an IPO and went through the process. We are an innovative manufacturing company entirely focused on our own R&D and our own design developed products which are scaled and taken to global markets. So one such platform that we have, which is a flagship platform, is called TrueNat. It's a multi-disease platform which can do 40 different parameters for 30 diseases on the same machine. And this platform is very unique in the sense that it is a completely battery-operated portable machine that can be deployed right at the primary level. So that way we are able to reach high-quality diagnostics right to the close to the patient, so that diseases can be diagnosed very early and treatment can be started early so that the patients can be cured. And at the same time, also they will stop giving TB to other people, which is an important requirement to make sure that the disease burden keeps coming down. So that is the major objective, to ensure that everybody has access to high quality diagnostics so that treatment and appropriate treatment can be started early. Patient mitigation happens. So this is just to give you a broadly, and then we also have two acquisitions which are synergistic in nature. One is on the radiology side, the other one is on the digital pathology side. So this will be another, so apart from our own R&D, the company will grow through acquisitions also. And we also partner with many startup companies who have good technologies who are not able to scale it up. So we work with them to take them to the go-to-market strategy. So multiple engines are used for the growth. So as we go along, we expect that we will be expanding geographically, product-wise, and also in verticals-wise. When I say vertical, I mean that right now we are in the human diagnostic area, but we also plan to get into the veterinary diagnostics, which is also a very huge opportunity, and these are all going to be our growth drivers in the future.
Yeah.
Hi, my name is Indranil Borkakoti. I am President Corporate Strategy and Investor Relations and Mergers Acquisitions. So as Sriramji mentioned about the brief of the company, so just to get a bit more detail in terms of the acquisitions, the company, which is digital pathology, is based out of the United States, USA, and we have recently got US FDA approval for our cancer care products in digital pathology. So that's the area we are looking at growing. The other business, which is radiology, which is 70% subsidiary of ours based out of Bangalore. We've also received US FDA approval for their ultra portable X-rays, both for human use and veterinary use. As Mr. Sriram mentioned, veterinary is a new vertical for us, and that's where we are also looking at going into the developed markets, because there's a huge demand for pet companions, and as you know, people spend a lot of money on pet care. So that's a segment we're looking at. We've also got approval for going into Europe under the CMDR approval process for the ultra portable X-rays, and also for one of our assays and on TrueNat for CTNG. So this is going to be our play into the developed markets. And as Mr. Sriram mentioned, our strategy has been to grow our product offerings as well also diversify globally.
Thank you, sir.
And the flagship platform we call it as TrueNat. So this platform we can test about 30 to 40 different parameters. एक ही मशीन है, एक बार वो मशीन लगे तो उस पर कंज्यूमेबल जो है वही चेंज होता है, कौन सा टेस्ट करना है, TB टेस्ट है कि कोविड टेस्ट है कि HIV टेस्ट है, हेपेटाइटिस है, सिर्फ कंज्यूमेबल चेंज होता है. सो दैट इज हाउ द थिंग इज डिजाइन. The idea being, जैसे बनने ने बताया कि the earlier you can diagnose, the better you can treat. So that people who are unnecessarily dying because of infectious diseases, जो बिल्कुल curable है, वो avoid हो जाएगा. Plus, once you treat these people, they also stop giving the disease to other people. So the spread of the disease also comes down. तो अगर disease eradication या elimination करना है, तो this is the only way it can be done, where you are able to diagnose very early, put them on the right treatment, so that the impact is very high. So just to tell you कि हमारा जर्नी कैसा रहा है, तो I started my journey in 1990 with my first company, called Tulip Diagnostics. This company at that time was the first Indian company to actually develop products in India for conditions in India and LMIC. So this company made a lot of diagnostic technologies. Some of them were global monopolies for a long time. They were a very large global player. This company grew to be a very large, the largest diagnostic manufacturing company in India. In 2017, we exited from this company. We sold it to a US company called Perkin. Tulip is still there and they are doing quite well. In this Tulip, we did very different kinds of diagnostics. But the molecular diagnostics, that area was not covered. At that time also I was aware that molecular diagnostics is the only thing which can change the impact in the infectious disease area. But it was not being used routinely or clinically. There was no clinical relevance because this technology at that time was very, very centralized. Itna centralized था कि मतलब hardly there were about before COVID maybe about 200 PCR machines in the country. So what happened was the time to
આપ સૌનું મોલબાયો ડાયગ્નોસ્ટિક્સની પ્રેસ મીટમાં હાર્દિક સ્વાગત છે. કંપની વિશે હું તમને બ્રીફ ઇન્ટ્રોડક્શન આપીશ. આપણા પેનલનું બ્રીફ ઇન્ટ્રોડક્શન આપીશ અને પછી આપણે પ્રેઝન્ટેશન સ્ટાર્ટ કરશું. So on behalf of the board, the management of Malbio Diagnostics and the book-running lead managers to the IPO, it is my absolute pleasure to welcome you all to this milestone moment, the launch of the Malbio Diagnostics Limited IPO. We at Kotak are proud to be associated with this IPO as a left-lead BRLM. It has been a privilege to work alongside a company that has developed an innovative point-of-care molecular diagnostics platform. Today, we are not just witnessing the public debut of a diagnostics company. We are celebrating the journey of an Indian innovator that has pioneered decentralized molecular diagnostics through its flagship TrueNet platform. It has built a diverse assay portfolio and expanded its presence over 80 countries, including key regions like Asia, Africa, Latin America, and continues to strengthen access to decentralized molecular testing. Malbio operates a vertically integrated business model with 5 manufacturing facilities in India, a dedicated research and development center in Bengaluru, and a team of 114 R&D professionals, including 100 scientists focused on innovation. Meet the visionaries behind Malbio Diagnostics. Mr. Sriram Natarajan, the Executive Director and CEO. Mr. Dr. Chandrasekhar Bhaskaran Nair, the Executive Director and Chief Technology Officer. Mr. Manan Kokhani, the Chief Financial Officer of the company. Mr. Shiva Sriram, the President, Business Development. Mr. Indranil Borkakoti, the Vice President, Investor Relations and M&A. On behalf of the book running lead managers, counsel, advisors and team deputies to the IPO, I extend a heartfelt thanks to Malbio Diagnostics team for their trust and partnership. The IPO provides investors with an opportunity to participate in a company that is focused on innovation, molecular diagnostics and expanding access to point-of-care testing across India and global markets. હું તમને ઇશ્યુની થોડી ડિટેલ્સ આપી દઉં. આશરે 940 કરોડની ઇશ્યુ છે, 200 કરોડ ફ્રેશ છે, 740 કરોડ OFS છે. Price band છે 807 at the upper end, 768 at the lower end. 18 શેરનો bid lot છે. એન્કર ઇન્વેસ્ટરનું પે ઇન અને ક્લોઝ કાલે છે, that is 7th August. ઇશ્યુ 10 તારીખે ખુલશે અને 12 તારીખે ક્લોઝ થશે. Now
इंट्रोड्यूस कराई दो Malbio Diagnostics करे जैसू. हमारी कंपनी एक इनोवेशन लेड मॉलिक्युलर डायग्नोस्टिक प्रोडक्ट कंपनी है. અમારું વિઝન છે કે હેલ્થકેર સિસ્ટમને વધારે સ્ટ્રેન્થન કરવું અને રિમોટ ટુ રિમોટ એરિયામાં હાઈ ક્વોલિટી હેલ્થકેરનું એક્સેસ અપાવવું. અમે ઇન્ટરનલી આખી પ્રોસેસ ઇનહાઉસ કરેલી છે. R&Dથી લઈને ડેવલપમેન્ટથી લઈને રેગ્યુલેટરી અપ્રુવલ અને એના પછી ઇનહાઉસ મેન્યુફેક્ચર એન્ડ ડિસ્ટ્રીબ્યુશન. અમારી પ્રેઝન્સ 90 કન્ટ્રીઝમાં છે અને ઓવરઓલ તમે વિચારો તો મોલિક્યુલર ડાયગ્નોસ્ટિક શું છે? આજે કોઈ પણ ઇન્ફેક્શિયસ ડિઝીઝ હોય જે ફેલાતા હોય એ આમ તો ક્યોરેબલ છે, ટ્રીટેબલ છે, પણ જનરલી એવું થતું હોય છે કે તમારું ડાયગ્નોસિસમાં જ એટલું ડિલે થઈ જાય અને એના હિસાબે અનનેસેસરી ઘણા બધા લોકોની મૃત્યુ થાય છે અને એમને અનનેસેસરી હેલ્થના ચેલેન્જીસ આવે છે. પણ WHO એ પણ રેકમેન્ડ કરેલું છે કે ઇન્ફેક્શિયસ ડિસીઝ માટે ટ્રેડિશનલ મેથડ કરતાં મોલિક્યુલર મેથડ વધારે સારી છે. મોલિક્યુલર ડાયગ્નોસ્ટિકને RT-PCR, જે તમે ઘણા લોકોએ સાંભળ્યું હશે કોવિડના ટાઈમમાં, RT-PCR ને ગોલ્ડ સ્ટેન્ડર્ડ કહેવાય છે ફોર ઇન્ફેક્શિયસ ડિસીઝનું ડાયગ્નોસિસ. તો એ જ ટેકનોલોજીને અમે વધારે રિમોટ એરિયા માટે એક્સેસિબલ બનાવી છે. જ્યારે આ ટેકનોલોજી લોન્ચ થઈ હતી એ વખતે એ રીતે બનાવી હતી કે એના માટે પ્રોપર ઇન્ફ્રાસ્ટ્રક્ચર જોઈએ, તમારે એસી જોઈએ, કન્ટિન્યુઅસ પાવર જોઈએ, તમને સ્કિલ્ડ ટેકનિશિયન જોઈએ ટુ વર્ક ઓન ધીઝ RT-PCR મશીન્સ. બટ અમે આખી પ્રોસેસ અને એના ક્લિનિકલ વર્કફ્લોને મિનિએચરાઇઝ કરીને એટલું પોર્ટેબલ ડિવાઇસ બનાવેલું છે કે જે તમે નાનામાં નાના સેટિંગમાં, તમે પબ્લિક હેલ્થમાં, ડિસ્ટ્રિક્ટમાં, ગામડાઓમાં તમે એને મૂકી શકો. એના માટે એ પોર્ટેબલ છે, ઉપાડીને ક્યાંય પણ લઈ જઈ શકાય છે. એને બેટરી